talking about a patient who has a right CVA and a hemorrhage to the anterior cerebral artery. A patient with this diagnosis usually shows left hemiplegia, left hemiparesis, abulia, unilateral neglect, and they're impulsive.
Our patient today is going to show signs of decreased sensation on the left side. The patient has decreased tone more in the left lower extremity than the left upper extremity, so we're going to do facilitatory techniques to work on that. Our patient needs supported when sitting statically and also has poor weight shifting. Our patient has poor bed mobility, so we're going to be teaching them some easier techniques today that's going to help them be more independent. And our patient has impaired gait, so we're also going to be working. Okay, so right now I'm going to show you 3 facilitatory techniques that you can use to increase tone, but I'm going to do it on the lower extremity. You can also do this on the upper extremity. So what I'm going to do is I'm going to take the patient's leg, I'm going to be holding it, and I'm going to apply a quick stretch. And then I'm also going to start taking them through rhythmic initiation, where I'm actually taking the patient through the range of motion, and this is going to help them feel what I need them to do. And then I'm going to tell the patient that when they feel the need, they can start helping me. And once she starts kicking in her own muscles, I can start tapping on the muscle belly, which is also going to increase tone.
Okay, now we're going to work on some postural stability and some weight shifting. I have a gait belt on her so that she doesn't get up and walk away and so she doesn't fall forward, and I also have this wedge under her left butt cheek so that she doesn't fall to her left side. So now I'm going to instruct the patient when I say 2, I want you to first reach the X with your right hand, and then I want you to reach this X with your left hand. So go ahead and reach with your right. Good. And now with your left. Good. And you would do that 3 to 5 times. And now I have the mirror in front of her because she has some left-sided neglect. So I'm going to have her reach on the floor. I have markings. Her right foot first. And then I'm going to have her use the mirror to mimic the movement from her right foot to move her left foot. So go ahead and move your right foot to this X for me. Good, and now with using the mirror, I want you to move this one to that X and mimic the movement you just did. Good, now do it again for me. Good, and then to the left. Good, and you would do that. Now we're going to work on some bed mobility techniques so that she can get in and out of her bed more independently. And then once I have her in the seated position, I'm going to do some sit and stand so that we can work on strengthening those lower extremities and to prepare her for some gait training. So what I'm going to do is I'm going to go ahead and cross her leg over here. And then I'm going to tell you to put your arms like this for me. Good. And then what I want you to do so that you can get yourself over onto your side is I want you to start rocking your hand. And then when you feel like you're getting a good enough momentum, I want you to take your head in the same motion. And then on the count of 3, we're going to roll. Okay? So go ahead and start rocking your hands back and forth. Good. Now go ahead and start using your head in motion. Okay, then on the count of 3, I'm going to stand here. On the count of 3, I want you to go ahead and roll it over to your side. 1, 2, 3. Good. Now next, I want you to use this leg to kick your feet off the table. Good. And use that elbow to push up into the seat. We're going to work on some sit to stands. So what I'm going to teach her to do is I'm going to have her focus on keeping your nose over your toes. So I want you to practice rocking for me. Good. Okay. And then what I'm going to do is I'm going to block her left knee because she's flaccid and she has some muscle strength on this one. So I'm going to have her use this to help push her up. I'm going to have you put your arms on both sides there. Okay. And then I'm going to have you start rocking, and then on the count of 3, we're going to stand up. So 1, 2, 3, stand up. Good. And we're going to stand there for about 5 seconds, and then we're going to sit back down. Go ahead and sit down.
Good. Now we're going to be doing some gait training with our patient. So since she has flaccidity in her left lower extremity, I'm going to be helping her by flexing her hip, flexing her knee, and we wrapped an ACE wrap around her ankle to hold her into dorsiflexion, which you can also have an AFO in place of that. So what I'm going to do is I'm going to ask her to move the cane first, and then blocking her knee, I'm going to lift this up, and then come with the good. So cane, bad, good. Bad? Good.